Welcome guys. Today I am discuss joint entrance msc nursing Wbuhs related MCQ, and this is the third part of MCQ. The first question is 76 question number. Restarting the client message in the nurse's own words is called option A paraphrasing, option B clarifying, option C focusing, option D summarizing. The correct answer is option A paraphrasing. Question number 77. Tendral bar position is used to prevent option A shock, option B aspiration, option C dyspnea, and option D is backache. We know the tendral bar position maintained in case of acute hypotension or in case of shock. So correct answer is option A shock. Question number 78. Atrial blood gas analysis result of pH 7.5, PaCO2 30 mm of mercury, bicarb ion is 24 MEq per liter, is diagnosed as option A respiratory acidosis, option B metabolic acidosis, option C respiratory alkalosis, and option D is metabolic alkalosis. The correct answer is option C respiratory alkalosis. Question number 79. Paradoxical movement of chest wall may be found in option A pneumothorax, option B failed chest, option C cardiac tamponade, option D pleural effusion. We know it occurs, failed chest occurs when your diaphragm moves in the opposite direction. Then it should when you are inhaling and exhaling. And the paroxysmal movement occurs when obstructed sleep apnea, trauma or injury in the chest wall, disruption of the nerve and mineral deficiencies. That reason the paroxysmal movement is occurred in chest wall. The right answer is question number 79. Right answer is failed chest. Question option B. Question number 80. In chest drainage, chest tube is placed in second intercostal space in case of option A hemothorax, option B hydrothorax, option C pneumothorax, and option D is empyema. The correct answer is option C pneumothorax. In case of pneumothorax, second intercostal space chest tube ta insertion kora hoy. Question number 81. The hallmark clinical manifestation of intestinal obstruction are option A malaise, option malaise, anemia and anorexia, option B abdominal pain, vomiting, distension and constipation, option C food intoleration, and option D bloody diarrhea. The correct answer is option B abdominal pain, vomiting, distension and constipation. Question number 82. The contraindicated drug for glaucoma is option A beta-loxol, option B pilocarpine, option C acetazolamide, and option D is atropine sulfate. The beta-loxol and pilocarpine, the drug is used for intercooler pressure, when intercooler pressure is elevated. That time in case of glaucoma, the pilocarpine and betasolol is used, and the atropine sulfate is not used because it is the mydriatic group of drug. This drug is increase the intercooler pressure. So right answer is option D. Question number 83. Which branch of coronary artery supply the atrioventricular node and Purkinje fiber? Option A left main coronary artery, option B left anterior descending artery, option C right coronary artery, and option D is circumflex artery. The correct answer is option C is the correct answer, right coronary artery. Abbreviation for microdipstate is option A micro GTT, option B GTT, option D C MDR, and option D is MGTS. The correct answer is option A micro GTT. Question number 85. Which of the following condition has an increased risk of developing hyperkalemia? Option A Crohn's disease, option B Cushing disease, option C chronic heart failure, option D end-stage renal disease. We know when hyperkalemia occur when the CKD means chronic kidney disease is present. That time the hyperkalemia occur. The right answer is option D end-stage renal disease. Question number 86. The most important dietary risk factor for prostate cancer is option A high fat diet, option B vitamin D containing diet, option C purine containing diet, and option D is drinking tea and coffee. The correct answer is option A high fat diet, because high fat diet is responsible for carcinoma. The prostate carcinoma can occur due to high fat diet. Question number 87. Excessive secretion of antidiuretic hormone is responsible for which of the following disorder? Option A diabetes insipidus, option B syndrome of inappropriate antidiuretic hormone, option C Cushing syndrome, and option D is addiction disease. If low level of antidiuretic hormone is secreted, that time diabetes insipidus occur, and Cushing syndrome is occur due to high level of cortisol. And the right answer is question number 87. Right answer is option B, syndrome of inappropriate antidiuretic hormone. Question number 88. Flanky paint appearance of skin is seen in option A dermatitis, option B pellagra, option C marasmus, and option D is kwashiorkor. The correct answer is option D. In case of kwashiorkor, flaky paint appearance of skin is seen. What is the not component of Apgar score? Option A, color of the baby, option B, muscle tone, option C, heart rate per minute, option D, respiratory rate per minute. We know the abbreviation of Apgar means A for appearance, and P for pulse, G for Giemans, Giemans means muscle tone, and after A is activity, and R for respiration. So heart rate is not present in Apgar score. The correct answer is option C. Boot shape heart is seen in which condition? Option A, ASD, option B, PDA, option C, TOF, option D, TAPVC. The correct answer is option C, TOF. Question number 91. All are the sign of hydrocephalus in a neonate except enlarged head, option B, sunset eyes, option C, delayed milestone, and option D is depressed fontanelle. The correct answer is option D, depressed fontanelle. Depressed fontanelle is not present in case of hydrocephalus. Question number 92. The most appropriate intravenous fluid for second and third degree burn patient during the first 24 hours is option A, lingual lactate solution, option B, normal saline, option C, albumin, and option D, 5% dextrose. The correct answer is option A, lingual lactate solution is used for in case of burn within 24 hours. A P wave on a ECG, question number 93. A P wave on an ECG represent an impulse, option A, originating at the SA node and depolarizing the atria, option B, originating at the SA node and depolarizing the atria, option C, originating at the AV node and depolarizing the atria, option D, originating at the AV node and spreading to the bundle of His. The correct answer is option A, originating at the SA node and depolarizing the atria. Question number 94. The following are characteristics of autism except option A, onset after 6 years of age, option B, repetitive behavior, option C, delayed language development, and option D, severe deficit in social interaction. We know that in case of autism, the signs in autism is start in early onset. That means onset as 2 years of age, and the impairment of basic social skill is also present, and repetitive of behavior also present. The correct answer is option A, onset after 6 years of age, because this onset is 2 years of age early. Question number 95. Which of the following statement is true regarding golden minute of birth? Option A, to start positive patient ventilation within 1 minute after birth, option B, to complete CPR within 1 minute, option C, observe 1 minute after birth for spontaneous ventilation, option D, all of the above. The correct answer is option A, the to start positive patient ventilation within 1 minute after birth. Question number 96. In patent ductus arteriosus, connection is between option A, aorta and coronary artery, option B, aorta and pulmonary artery, option C, aorta and subclavian artery, and option D is pulmonary artery and subclavian artery. The right answer is option B, aorta and pulmonary artery. Question number 97. Which of the following is a minor criteria for diagnosis of rheumatic fever according to the modified Jones criteria? Option A, ASO titer, option B, carditis, option C, fever, and option D, subcutaneous nodule. We know in Jones criteria there is some major criteria is present and some minor criteria is present. The major criteria means carditis, changes and subcutaneous nodule is also is present in major criteria, and in minor criteria fever more than 38.5 degrees centigrade, prolonged PR interval, polyarthralgia, all these are present in minor criteria. So here is minor criteria, you are asking the minor criteria. The right answer is option C is the right answer. Question number 98. The bleeding pattern in placenta previa is option A, painful bleeding, bright red bleeding, option B, painless bright red bleeding, option C, painful dark red bleeding, option D, painless dark red bleeding. The correct answer is option B, painless bright red bleeding. Question number 98. Question 99. A 10-month-old child has had a cough that lasts 3 days, has a breathing rate of 40 beats per minute, and an examination no chest indwelling. How a nurse will classify the disease? A chest indwelling is not present, so option A is no pneumonia, option B is pneumonia, option C severe pneumonia, and option D very severe pneumonia. The correct answer is option A, no pneumonia is the correct answer. Question number 100. Large for gestation age is when the birth weight is greater than the option A 95th percentile, option B 85th percentile, option C 90 percentile, option D 80 percentile. The correct answer is 95th percentile is the large for gestational age. Thank you guys. Please watch my channel and subscribe my channel for more information.